All right, let's talk about emailing and texting clients. If you've ever wondered whether iMessage, FaceTime, or Gmail are okay to use, then you're definitely not the only one. This comes up all the time, and the advice that you see on the internet and from supervisors is all over the place. Some people will say that HIPAA says that you can't do this at all, and then others will say, sure, you can do it. Everybody does it. Understandably, people get very confused about this, and if I'm being honest, HIPAA is partially to blame. A common misconception is that HIPAA makes it really clear what you can and can't do, but HIPAA isn't in fact just a list of apps and a yes or a no checkbox next to them. That is not HIPAA at all. Instead, it's a set of rules about risk management and safeguards. That's why there's no magical list of approved apps, and that's also why two different therapists can follow the same rules but then arrive at completely different approaches. So about texting and emailing specifically, we're going to jump into the details here in a second, but at a high level, HIPAA does not explicitly ban texting or emailing clients. If a client asks to use a less secure method than what's available on your EHR, like iMessage or FaceTime, then you can actually say yes, depending on how you handle it. So there is no explicit HIPAA rule that says no texting or no emailing. The important thing to note with the client there is you have to be able to coherently explain the privacy risks to them. And then once you've explained it to them, you also have to document that they understood it and are now accepting the risks that come with using that communication method. That is in fact the actual HIPAA guidance. It comes straight from the Office of Civil Rights. Specifically, it's called a patient's right to alternative means of communication. It is perfectly okay to accommodate their requests provided you've had that conversation with them and documented it. Okay, so I think that's clear, but then here's the tricky part. Just because you can do that does not mean that you necessarily should. Most compliance experts, malpractice carriers, and licensing boards recommend that you keep all PHI on a secure platform like an EHR. And then PHI, just as a reminder, is any information that can be used to identify a client and that relates to their health and care. And when you think about that definition, that actually includes a lot more than you might think. It's not just somebody's name and age that fall under that category. And this is the sole reason why EHRs, telehealth tools, and a whole host of HIPAA-compliant specific tools exist. They give you encryption, they give you audit trails, and then most importantly, they give you a signed business associates agreement, also known as a BAA. Without this BAA, you don't have the legal framework in place to manage client information in a HIPAA compliant way. So I think all that makes sense. Now let's break down some common scenarios that people run into. Scenario number one, logistics only texting. I would say this one is pretty easy. These are things like rescheduling, I'm running late, I'm outside the door but it's not open. Logistical things like that don't have any PHI. In those cases where there's no PHI and no clinical context, I personally think, and from the therapists that I've talked to, I think this is the majority view, it's perfectly okay to use something like text message or iMessage for that. The one tricky part of this, and this is probably something that you've been warned about in school or maybe from one of your supervisors, is that you have to be absolutely sure that you're texting the right number. Accidentally texting the wrong person, even if it's just logistical things related to therapy, could reveal the fact that somebody is getting therapy, which is also not great. So that caveat aside, as long as you're really careful about who you're texting and it's just logistical information, I think the majority view among therapists is that this is okay. Then you have scenario number two, which is trickier, and that's when the client sends you PHI. So the client initiates PHI over an insecure communication medium like text. This is where the HIPAA's alternative means clause comes into the picture. And of course, this assumes you have the right informed consent for the client about this alternative means of communication in place, right? So that's a given. Back to the client texting you PHI. If a client texts you something clinical, like a question about treatment or just an update on symptoms, you can actually reply. But from the therapists that I've talked to, most recommend responding with something like, and of course, this depends on whether or not this is possible, but if possible, you could respond with something like, thank you for letting me know, let's talk about this more in our next session. That way, you acknowledge their message in a respectful way, and you also don't have this really long back and forth where you're exchanging tons and tons of PHI, because the risk there is much higher than if you just exchange a little bit of PHI. And then of course, finally, documentation is everything. The fact that you had this exchange should also be documented in your notes somewhere. Now let's talk about scenario number three, in which you initiate the sending of PHI. I think some people might argue that the alternative means of communication clause might still apply here, but personally, I don't think it does. And I think the view among most therapists here is that this is extremely risky, and if you're going to initiate the sending of PHI to a client, you should always try to do it over a secure platform that is HIPAA compliant, that has signed a BAA, something that includes encryption and audit logs. And before you ask, Apple does not sign a business associates agreement for iMessage. So if you're initiating this type of conversation, then iMessage would not be okay and would not be HIPAA compliant. Now let's talk about scenario number 4, email. So the same kind of rules apply that we were talking about earlier with texting. If a client wants to initiate the sending of PHI through email, then that alternative means clause comes into the picture from HIPAA. And as long as you have informed consent, then most therapists will say that it's probably okay to do that. Although, of course, if you have some sort of mechanism to communicate this through your EHR, that would be better. And if possible, you should respond with something like, thanks for letting me know, let's continue this conversation in our session, or something to that effect. And then of course, if you need to initiate the sending of PHI to a client, then you should always use a EHR or secure HIPAA compliant messaging tool. Let's go to scenario number 5, FaceTime. As I'm sure many of you know, during COVID, the government allowed non-HIPAA compliant tools like FaceTime to be used for telehealth. That was a temporary exception that was made in a state of emergency, and that exception ended in 2023. Now, in 2025, when I'm filming this, you're expected to use a telehealth provider that will sign a business associates agreement like Practice Picnic. Okay, but then some people might argue, well, FaceTime is end-to-end encrypted and doesn't store calls, which is probably true and fair. That's a good response. But I would remind everyone that being secure is not the same thing as being compliant. So I would agree, FaceTime is probably a very secure means of communication. Apple has top-notch security and privacy controls, but they're not designed for healthcare communication. And so they don't have some of the administrative stuff that you need to be HIPAA compliant. So it's secure, but not HIPAA compliant. And that's why my recommendation and the shared view among most therapists is don't use it for your telehealth sessions. You can use it as a backup option in case your primary telehealth provider fails or goes down for whatever reason. But then when you do that, always document why you had to do it. And then really quickly on the text message thing, this is not necessarily related to HIPAA, but I've seen it come up over and over again. And that is the problem of setting boundaries when you're used to communicating with your client through text messages. It makes it harder to set boundaries when you're constantly communicating with clients through this really personal medium that is text messaging. If the expectation has been set that you're only going to communicate with a client through the EHR secure messaging system or through some other HIPAA compliant mechanism, then it's a lot easier to set boundaries, and you can only check that when you're in office, blah, blah, blah. So even in the cases where text messaging might make sense and might be okay from a HIPAA point of view, there might be other reasons why you'd want to stay away from it. And this is also why a lot of therapists have an autoresponder that says, I usually check, text messages within 24 to 48 hours, so that you're kind of managing the client's expectations appropriately. Okay, so let's get to the bottom line, and that is that HIPAA is messy. Some people might try to convince you that HIPAA is black and white and there are right and wrong answers. There's certainly better and worse answers to questions related to HIPAA, but there's still a lot of nuance and subjectivity and interpretation involved. And that's why I was saying earlier, two therapists could follow the rules to the T and arrive at different approaches, and that's okay. So there's some flexibility in HIPAA there. But then that flexibility is also what creates all of this confusion. So if I had to boil down the takeaways into just a couple of things, it would be if you're just communicating logistics like I'm running late or I'm outside, something like that, then it's okay to use something like text messages or email, and a lot of therapists use that, and that's okay. When it comes to communicating clinical information, that's a lot riskier, and my personal recommendation, and I think most therapists would share this view, is to always just use a secure HIPAA-compliant messaging system whenever you need to communicate clinical information. If it's unavoidable, and sometimes it is, HIPAA does have the alternative means of communication clause that I mentioned earlier in this video, but even then you should try and restrict how much clinical communication happens. And if you can, try to push for handling some of that stuff in session by saying things like, thanks for letting me know, let's talk about this more in our next session. And then when it comes to telehealth, while it might be okay to have FaceTime or another video conferencing tool as a backup, your primary telehealth platform should be HIPAA compliant. And in the cases when you need to resort to your backup, always document that and explain why you had to do it. Okay, that's it. I hope this video on HIPAA was helpful. If it was, please subscribe to this channel for more content like it.